shows the devastation that the conference, that the pandemic has caused. I'm going to share my screen and start showing some slides. Okay. Can you see the slides?
Yes.
Great. Okay. Okay, so I'm going to talk about poverty in rich societies in the context of the global pandemic. But first, I just wanted to say a few words about one of the keynote speakers who was scheduled to talk at this conference, who unfortunately died before the conference could actually take place. Professor Ray Forrest was an old colleague and friend, and he was working at Lingnan University. He made seminal contributions to our understanding of the complex relationships between the housing market and poverty in rich societies. And his early death is a tragedy. We've lost far too many people over the past year. And I'm sorry not to be able to hear him speak again. Ray work gave insights into an old theory of why, when we are living in some of the richest societies in history, poverty continues. Why hasn't poverty been eradicated in rich societies? One of the first major studies into the reason behind this was by Henry George in his famous book, Progress and Poverty. Many students today have never heard of this book, but it is probably the most widely read social science book in world history. At one point, it was selling more copies than the Bible and launched a major political agenda in the United States and around the world. His answer to this question of why in the developing USA at the time, when cities were getting richer and richer, there seemed to be more and more poor people, was that as the economy grew, so did the rent on land and natural resources at a faster rate than the increase in wages or the growth of capital. And therefore, as societies became richer, so the cost of living, particularly to the poor, particularly because of the cost of housing in many countries, or the cost of rent in general, grew at a faster rate. And so even though wages were going up, the cost of living went up faster. His remedy for this was a land value tax, which he argued society could recapture the value of its common inheritance. The earth is a common inheritance for all. Raise wages, improve land use, and eliminate the need for other taxes. Unfortunately, very few countries have ever implemented this idea. So I'm going to talk about poverty in the context of the SARS-CoV-2 pandemic. This has been a devastating international event. It's estimated using excess death figures, which are probably the most comparable way of estimating the number of deaths so far, that about 7 million people have died of COVID-19, about twice as high as the number of reported deaths. In 2019, before the pandemic started, there was a major study called the Global Health Security Index, which ranked countries by their ability to respond to any forthcoming pandemic. Of course, when this study was published, they didn't know that a pandemic was on the way. And these countries marked in yellow were the ones which had the greatest ability to respond according to that major academic study. The United States was ranked as first, the United Kingdom second. As you can see from the numbers of excess deaths, they were way far off the mark. There's been huge numbers of deaths in both the UK and the USA. In fact, as you look down the list of the countries which were likely to be most able to cope with the pandemic, Only Australia, Thailand and Korea stand out as having actually managed to succeed. Way down at the bottom of the list were the African countries on their ability to cope, and yet they who have been experienced at coping often with infectious diseases and epidemics and pandemics have done the best overall. So Togo, which was ranked 161st out of 191 countries, managed to suppress the virus. Uganda, ranked 150, implemented 35 measures before they had their first case, and also suppressed the virus over the summer, although the new Delta variant is now causing mass death and destruction. In the UK, you can see the effects of COVID-19. This shows the number of deaths per thousand of infectious diseases since 1901. And you can see that the number of deaths due to infectious disease of COVID-19 has returned the UK to the levels of death rates from infectious disease not seen since the 1920s, long before the invention of antibiotics and many of modern medicine we have today. There are successive waves of COVID-19. We had the original variant causing a wave, the Alpha variant, and now the Delta variant, which is spreading around the world. And so this is likely to increase. Because there were no vaccines initially, and it's taking time to roll out vaccinations, economies basically went into lockdown, and this had a devastating impact on the economic growth rates, which went into negative across most of the rich countries in 2020. This is the OECD's projected changes in GDP in 2020 forecast at the end of December last year. And as you can see, the UK saw GDP fall of 11%. Only Argentina did worse, but virtually all countries, with the exception of China, saw contraction of their economy. So who does this affect the most? Well, bioarchaeological research from prehistory showed that even in pre-industrialized societies, the people at greatest risk of pandemics, the one the pandemics affected the most, were often those who were originally marginalized, the poor minorities who faced discrimination in the ways that they damage their health or limit their access to medical care. The advent of industrialized societies didn't change that pattern. And there's classic studies of the typhus epidemic in Upper Silesia, which again showed that the pandemic was spread in part because of the conditions, the terrible living conditions of the poor. The economic damage caused by the COVID pandemic is likely to see a massive increase in extreme poverty. We're not sure how much that's going to increase in the poor countries. Estimates at the beginning of the pandemic were anywhere between 85 million and more than 500 million people plunged into extreme poverty. But there's also likely, as we'll discuss, to be an increase in poverty in the richer countries. So the World Bank predicts at the moment, and this is the one from January 2021, it keeps changing, that instead of the numbers in extreme poverty falling steadily from 2015 towards 2030, when extreme poverty is meant to be eradicated according to the SDG agreement, the pandemic is likely to see all the gains that have been made since 2015 wiped out. Extreme poverty will be higher than it was at the start of the SDGs. So, what do we know about pandemics in the 21st century and the effects that they've had? Well, the IMF, the chief economist and his team did a recent analysis where they looked at the effects of the 5 epidemics and pandemics on inequality in the 64 countries that have been most affected by the pandemics in the 21st century prior to COVID. The SARS pandemic, H1N1, MERS, Ebola, and Zika. And across the 64 countries, which covered high, middle, and low income countries, what they found is that those at the top during the pandemic saw a small growth in their incomes as a portion of the income of the country. But following the end of the pandemic, their incomes continued to grow. They benefited more and more. So that after 5 years after the end of the pandemic, they were 6% richer on average. By contrast, those at the bottom of society, the poorest 10%, saw their incomes fall by about 3% during the epidemic or pandemic. Then after the pandemic had ended, their incomes continued to fall relative to the rich, and they lost about 12% of their income. You get the same pattern if you look at the top and bottom 20%. It is likely that the SARS-CoV-2 pandemic, which is much larger than these previous ones, will lead to even greater inequality and even greater poverty across all countries, not just the poorest countries in the world, unless governments take active interventions to stop this growth in inequality. It's likely to happen inevitably. We already start from a situation of tremendous inequality in the world today, and of little benefit to the poorest, even in rich societies, of the economic growth we've seen over the last 30 or 40 years since the neoliberal agenda became dominant. If we look in North America and Western Europe since 1980 to 2016 and see who has benefited from the tremendous economic growth seen in the rich societies over that 36-year period, what's been found is that the top 1% captured 28% of the global the growth in those countries, whereas the poorest 50% in North America and Western Europe only benefited by about 9% of that growth, and those at the very bottom benefited hardly at all. So it's estimated at the moment that the richest 1% continue to own more wealth than the whole of the rest of humanity put together. About 51% of global wealth is owned by 1% of individuals. Analyses by the UK Parliament has shown that if the trends that we've seen continue before the pandemic, that is, then by 2030, the richest 1% would own about 2/3 of the planet's wealth. The pandemic may accelerate that trend. And what we've seen in a rich country like the UK, this is the Gini coefficient since 1937 to 2012, is that by the 21st century, we had begun to return to levels of inequality not seen since before the Second World War. And this pattern is repeated in other countries, but many of them don't have as long a time series. So what has been the response of governments to this huge economic shock of the pandemic and the need to shut down economies? Well, there have been huge amounts of money spent in some countries. So the countries shown in dark green, the USA, Canada, the UK, Australia, have spent more than 10% of their GDP on trying to ameliorate the effects of the pandemic. 25% in the USA, 15% in the UK, similar amounts in the European countries. There's an interesting pattern in the need to spend to ameliorate the effects of COVID-19. Obviously, poor countries in Africa simply didn't have the fiscal space to increase spending. But interestingly, countries which had comprehensive welfare states, such as the Nordic countries, the Netherlands, also haven't had to increase their spending as much as countries with a not as comprehensive welfare state, the Anglo-Saxon uh, welfare regime countries. This is arguably because their welfare states were able to cope with even the shock of the pandemic. And so they simply didn't need to increase the spending as much. It's not like Norway has a fiscal constraint on spending. It could have spent as much as the US or the UK. It simply didn't need to. So that shows the importance of a comprehensive welfare state in dealing with major shocks such as a pandemic. When we look at the effects on a country like the UK of the pandemic, despite the huge amount of government spending to try and ameliorate its effects, it has been unable to fully protect the population. So the coronavirus financial impact tracker survey found that a third of households in the UK had reported a fall in income, and 10% of households were in serious financial difficulty, and 16% were struggling to make ends meet. Almost 5 million adults are food insecure in the UK compared to 2 million pre-lockdown, and it was a scandal that there were 2 million adults food insecure even before the lockdown. This includes 1.4 million children. Furthermore, last summer, 11% of children reported their families had to visit food banks, rely on charity in order to put food on their table. And this was higher amongst ethnic minority populations. Similarly, as we can see from previous pandemics, those on low-income jobs are more likely to have seen a reduction in their earnings, or to have been laid off work or reduced their hours, had their hours reduced, than those who were high earning before the pandemic. And so we see a really depressing picture. Even though 16% of GDP has been spent on supporting businesses and families to ameliorate the effects of the pandemic, we see 3 million children whose families are constantly struggling to buy food now, and 4 million children in families that have lost income. There are almost 5 million children now in households with no savings. Their savings have been wiped out. Other countries, rich societies, have seen similar devastating impacts of the pandemic. It's not just that the pandemic has caused a rise in poverty. It's also that the poor are more likely to have suffered from ill health during the pandemic. There are a range of reasons from this. Poor people are more likely to be key workers, for example, care assistants, shop assistants, building workers, bus drivers. So they're more likely to come into contact with infected people than those in richer areas who may be able to work from home. The low paid in many rich countries are the ones who do the most important jobs, as we found out during the pandemic. You may be able to live without an asset fund manager. You may be able to survive perfectly well without a corporate lawyer, but it's difficult in a pandemic to survive without a nurse or a refuse bin collector. Many key worker jobs are low paid, and therefore key workers often live in deprived areas, and deprived areas are more likely to have to rely on public transport than the people in richer areas, and therefore be more likely to come into contact with people who are infected with COVID. They're more likely to have worse connections and not be able to afford the premium for home deliveries. And deprived areas tend to have higher population densities than richer areas, less green space, and therefore people who live in these areas are more likely to come into contact with an infected person when they leave home to exercise or go food shopping or medical care. Higher population densities and higher densities within housing make it more likely that the pandemic will spread, and that differentially impacts poor people in rich countries. Unfortunately, poor people have also been found to be more likely to die from COVID-19 infections. There's a higher risk of severe disease and death from COVID-19 infections if you have an underlying health condition, such as hypertension, diabetes, respiratory disease or cancer. And we know from studies around the world on health inequalities, mainly from rich country societies, that the poor are much more likely, 50% to 100% more likely to suffer from ill health than the rich after allowing for age and gender. People in deprived areas are more likely to suffer from these underlying health conditions than in richer areas for a range of reasons, including greater pollution levels, greater stress, greater inflation levels, greater risk of H. pylori infections in childhood due to overcrowded housing. These are the causes of these underlying health conditions. And in many countries, particularly where healthcare is expensive and inverse care law operates, which means that the quality of medical care is inversely related to the need. Medical care is often better in richer areas than in poorer areas. So the poor are more likely to get COVID-19 in rich societies. They're more likely to die of it. So they're more likely to see their income fall because of it. If we again, I'm using the UK as an example, look at the death rates from COVID-19 by area deprivation, from the 10% that are least deprived to the 10% that are most deprived. Those in the 30% living in the 30% most deprived areas in the UK are more than twice as likely as those living in the richer areas to die. Now, people living in poor areas are more likely to die after allowing for age and gender than those in the richer areas of all kinds of diseases. But COVID is even worse than other diseases known to affect the poor. It really does kill the poor differentially in rich countries. Okay, so COVID-19 is likely to have an economic and health effect on the poor. What is the likely pattern given what we know about healthcare and the poor in a society like Hong Kong? I'm going to look at a number of studies on poverty and social exclusion and its relation with health in Hong Kong. Many of those studies details of them can be found on the Poverty in Hong Kong website, which particularly discusses the work led by Dr. Maggie Lau and Professor Hung Wong. And if you don't know this website, I recommend, and you're interested in poverty and health in Hong Kong, I recommend you look at it. At the moment, there is these methodologies that have been used in Hong Kong use the consensual deprivation method to look at the relationship between poverty and ill health. And this is arguably the best method that we know of for measuring accurate, reliable, robust measures of poverty. And there's a UNICEF-led collaboration that's going to launch in the near future, which aims to improve the measurement of poverty in low, middle and high income countries by developing and piloting a global consensual poverty survey question module that can be slotted into mainstream surveys. There's an urgent need because of the likely effects of the pandemic on increasing poverty and on increasing inequality to have better global measures of poverty, and the consensual deprivation methodology is probably the only method that can be used to make comparable results in high, middle and low income countries. It helps set the minimum acceptable way of life in all these countries, and it allows you to go beyond income and look at deprivation, and therefore look within the household as well as between households. Look at the difference in poverty between adults and children, men and women. It reflects the experience of the poor. It reflects the societies to which they're applied. It has age-appropriate methods. There's a clear justification as to why you've selected these indicators, a statistical method, and it enables meaningful international collaborations. If you're interested in participating in this initiative, then next month an online platform will be set up initially on this website, but towards the end of the year on the UNICEF website. So, as I said, many academic-led studies in Hong Kong have been at the forefront of poverty measurement methodology and improving what our knowledge of poverty amongst the world. And I'm going to look at two of the last studies. This last one, the SPPR, is ongoing, and a third wave is going into the field in 2021. And I'm going to look in particular at the results from the 2013 study and the more recent results from this particular section of the SPPR study on poverty, disadvantage and health inequalities. This part of the study focused on social disadvantage of health of people in Hong Kong, looked at trying to make policy recommendations to alleviate the impact of poverty on health. And this is particularly important given the effects of the pandemic. A literature search was done in Hong Kong on looking at the relationship between social determinants of health, inequality in health, and poverty in health. And it's a considerably under-researched area in Hong Kong. Only 10 papers were found by this comprehensive literature review, systematic literature review. So if you're a postgraduate student looking for a project, then social determinants of health in Hong Kong and other East Asian countries is an under-researched area. In 2013, it was found that 23% of the population of Hong Kong had difficulty accessing medical, dental and optical care due to unaffordability. They simply couldn't afford to go to the dentist or have their eyes checked or seek medical care when they needed to. The resulting poor health affected about 1 in 5 people's financial situation, reduced their ability to work, and amongst the poor, their health, about 1 in 5 people reported that their health had been affected by a lack of money. Poor households in Hong Kong were 10 times less likely to consult a doctor or have regular dental or eye checkups than their non-poor peers. This is in part because of there's a cost to going to see a doctor in Hong Kong, unlike, say, the United Kingdom, where healthcare is free at the point of use. The more healthcare costs, the more it's restricted access to the poor. Limited access to affordable private doctor consultations often contributes, arguably, to excess stress on the accident emergency services in hospital. And these are particularly important that there's not non-COVID related stress on accident emergency during a pandemic. There's only a limited capacity in these. Unaffordability of optical and dental care services may also have long-term health impacts on the well-being of the population. The first major study examined the association between income, poverty, deprivation and health status in Hong Kong was by Chung et al. In 2018. And its findings were that being deprived of being excluded from being able to participate in your society because of a lack of money was significantly associated with worse physical and mental health outcomes, even adjusting for other effects. So you were 66% more likely to suffer from worse physical health and 83% more likely to suffer from worse mental health if you were poor in Hong Kong, deprived in Hong Kong or poor in Hong Kong. This, of course, has a multiplicative effect during the pandemic because it's those who suffer from worse physical health are more at risk. And obviously the pandemic also has an impact on mental health. This is the differential impact on the poor. Now, if we look at Hong Kong, its health system is very efficient. Hong Kong society only spends 5.4% of GDP on healthcare, which is low by rich society standards. It has very good outcomes, one of the lowest neonatal mortalities in the world and some of the longest life expectancies. However, this efficiency comes at the expense of excluding a chunk of the population. So amongst rich societies, Hong Kong and the US, its finding is about 1 in 5 people can't afford to go and visit a doctor or skip a medical test or don't have treatment because they can't afford to go there. And in a pandemic, this becomes extremely problematic. The results from the studies were that about 8% of people in Hong Kong did not seek medical care in the previous financial year. This was 2017, because of they couldn't afford it. This may have increased considerably during 2020 and 21. The people who did not seek medical care because they couldn't afford it were differentially women, or differentially students, people working in elementary jobs, and people who are already sick, suffering from pain symptoms which affected their daily life. The effects this had is that there's higher stress levels, worse physical health, quality of life, worse mental health, quality of life, and higher disability rates. Those who cannot afford medical care in Hong Kong have worse health than their richer peers. It's already the least healthy who are excluded, and the pandemic is likely to have made that worse, particularly in high-income countries, high-income societies, where there's already barriers to seeking medical care. The other problem, of course, is long COVID. It's estimated in the UK that 1.5 million people may be suffering from long COVID. We don't know the effects of long COVID in the longer term. Obviously, COVID damages the olfactory nerve. It stops you being able to smell. And recent brain scan studies from the Biobank in the UK have shown that it begins to spread from the olfactory nerve into the frontal cortex of the brain and do brain damage. And particularly those who had a severe illness may be at greater risk of Alzheimer's in the long term. Long COVID seems to affect differentially people of working age and differentially affect women of working age. So there could be long-term consequences for the working age population from long COVID, even if it has not led to a huge increase in deaths amongst the working age population. Okay, so the pandemic is not the only major problem facing rich societies in terms of increasing poverty. There is the existential threat of climate change, which I'll just quickly discuss. If we look back to 1979, all the environmental parameters which are driving climate change have been getting steadily worse. Greenhouse gases have been increasing, ice coverage has been declining, the oceans have been warming up, they're becoming more acidic, sea levels have been rising, and extreme weather events such as typhoons have been increasing. And the cost of these extreme weather events is gradually climbing. At the moment, nowhere on Earth, apart from maybe the high plateau of the Antarctic, is uninhabitable for human life. However, if all the current fossil fuel reserves, or the oil and coal in the ground is burnt, then the temperature will warm by a large amount, and the areas marked in purple, brown and purple on this world map will become uninhabitable for human life without artificial cooling. Basically, the temperature will rise above 35 degrees with 100% humidity equivalent. At that point, you cannot lose enough heat by sweating, and you become sick very quickly and die of heat stroke. This means if all the current reserves are burnt, large parts of Australia, China, India, Africa, Europe, North and South America will no longer be able to sustain human life outside during the summer, parts of the summer months. This will be the end of global civilization as we know. This means that there are considerable amounts of coal reserves and oil reserves and other fossil fuel reserves which are unburnable if we want the current global society to survive in the long term. The problem with this is that the fossil fuel companies, there is 4 trillion of equity and they have 1.3 trillion in debt to the world banks. If these reserves become worthless, then this money is effectively wiped out. At the moment, they're highly profitable. 126 billion is repaid to the people who own the equity in dividends. 27 billion is repaid to the banks and financial institutions in the debt. And massive investment is made in finding more fossil fuel reserves. Yet less than half the proven economically recoverable reserves can be emitted up to 2050 if we're to stop the kind of global warming that can have a devastating climate impact. The trouble is, we found in 2008 that the global capitalist system is very unstable. There are about 30 million businesses on the planet, but the overwhelming majority are small businesses, small shops, plumbers, electricians. About 43,000 of these global companies are transnational corporations, which are the drivers of global capitalism. And there are about 1 million ownership ties between these companies. But what was found is that 80% of the shares in the 43,000 transnational companies are controlled by only 737 firms, mainly big banks. And amongst these big banks, Credit Suisse, Deutsche Bank, Barclays, Merrill Lynch, there's also a network of ownership, so they own shares in each other. This is a very unstable network system, and when one of the foundations of this system, Lehman Brothers, collapsed, the whole global financial system crumbled in 2008. And if we look at the value of the biggest banks, these big circles represent the worth of the biggest banks. In 2007, before the financial crash, these small dots represent how much these banks were worth a year later after the financial crash. To put this in perspective, this bank here, its worth before the crash was the equivalent of the GDP of the United Kingdom. Stupendous amounts of money were lost by the biggest banks, the equivalent to the GDP of North America and Europe combined. So the world faces the problem of how to decarbonize, not use all the fossil fuel reserves, which means all those assets will become worthless, without crashing the global financial system and plunging the world into an economic depression and mass poverty. So let's summarize the challenge of this picture, and particularly the poverty challenge of the pandemic. The COVID-19 pandemic may increase inequality and relative poverty in rich societies to levels not seen since before the Second World War. We may be going back 100 years in terms of the economic gains that have been made by those at the bottom of society. Poor people in many countries are being hospitalized and dying of COVID-19 infections at twice the rate of rich people after adjusting for age and gender. At present, most governments have few policies which attempt to reduce the inequalities in severe COVID-19 infection and death rates. At present, most governments have announced few medium or long-term policies designed to reduce the likely increase in inequality and poverty resulting from the economic impact of the pandemic. They've implemented short-term policies, but most governments are going to remove those policies And then we may see inequality and poverty accelerate even more than they have been. On the positive side, the COVID-19 vaccination program is going relatively well in many rich societies, and the governments have significantly increased short-term social spending where it's been needed, and this has alleviated the worst economic effects of the pandemic. There's no inevitability that this pandemic will lead to mass poverty across rich, middle and poor societies. But unless governments start responding to this likelihood, then the situation may become very grim. I'll leave you there. Thank you very much.
Dave, for that very broad-ranging and very provocative, and I must say rather depressing presentation, if you don't mind me using that term. Depressing in terms of its content, not the delivery, of course. And also for finishing just about dead on time. I've got my exactly 40 minutes from where you started. So that leaves us with about 10 minutes of questions. If you'd like to ask a question, I can't seem to get everyone on my screen here. So what I suggest, while I play around, yes, I got that. If you'd like to ask a question, I suggest the simplest thing to do is to do that. And I have a question immediately from Tao Liu. So would you like to start off with your question? Please try and keep the questions brief so we can get as many in as possible. Thank you.
Okay. Professor Gordon, thank you very much for your presentation. Very interesting study, very interesting research. I have two questions and one comment. The first one is to the world order before the pandemic and after the pandemic. Before the pandemic, we have a very clear world order: high-income countries, welfare state, and low-income countries, possibly non-welfare state. And the welfare state with high-income country can deal with many things very well and effectively in the efficiently, like pandemic. And low-income countries not. But now it seems that the pre-existing world order has been partially messed up or disrupted. How can we explain this anarchical new world order? So why can we explain even the very high income countries can now deal with this issue very effectively? That is the first question. The second one is to the different type of social policy, like the Bismarck countries and the Belgian model. Are there any difference for these two types of welfare states to cope with the pandemic during the crisis period? That is my second question. And the second is one comment, and you have mentioned on the ecological issues and the global warming and so on. But I think in this issue, we need a complete reflection and a rethinking on the modern welfare state, which is based on the Keynesianism and which is based on the energy consumption or consumer consumption, because welfare state generally it creates it enhances the well-being of our country. So it promotes many consumers, boosts the domestic demand. However, it is not it is very unlikely to make it compatible with the ecological target. So how can we make this social, ecological, and economic target compatible? That is a very good challenge for the 21st century. So I have read a short working paper on the greening welfare state and ecologizing social policy. Maybe that is a very new area for the new social policy governance in the 21st century. Okay, thank you very much.
Wow, there are some wide-ranging questions. The countries which coped with the pandemic were clearly not the ones that the World Health Organization and Western academics who largely did that UNESCO study thought. I mean, the list bears no relationship, of the preparedness bears no relationship to the success of those countries. And you had very low income countries like Togo, Uganda, Rwanda in Africa doing effectively suppressing the virus. They stopped it before it had arrived and stopped it in those countries. Those countries were ones, even though they had very weak health systems, were health systems that were geared towards fighting infectious diseases. And countries like South Korea, which also had geared up to infectious diseases following the shock of SARS, also suppressed the virus. Countries like Australia and New Zealand also suppressed the virus. So the pattern wasn't necessarily due to the wealthy countries being better than the middle income countries or the poor countries. There were successes in Uruguay, middle income countries as well. It was basically how quickly the government responded and whether they had an effective plan and whether they were prepared to take the economic hit initially. And what a recent study in the Lancet has shown is that the argument that we must wait before we implement measures because otherwise it will damage the economy is completely wrong. The countries that rapidly implemented measures to stop the spread were the ones that did economically the best. So China is an example, even though it could have had a devastating pandemic. It's literally locked everything down and stopped people leaving their homes, and its economy was one of the few that grew during 2020. So what we thought was preparedness and what actually was were two different things, and the world needs to learn that lesson. In terms of the science, at least the basic science funding did lead to unbelievably rapid vaccinations. I mean, the projections were at the start of the pandemic, there probably wouldn't be an effective vaccine until the end of this year, and their first vaccinations occurred in the UK on the 8th of December last year. So that's quite a remarkable achievement by the scientists. So the world order has changed in terms of that. And also the world order may change because of the long-term consequences of this pandemic. It's not over yet. Global warming, yes, I agree with you entirely. There does need to be a major restructuring, either because global warming is an existential threat and the days of reckoning are rapidly approaching, according to our natural science and environmental science colleagues. So a model which the World Bank and IMF have been pursuing, that economies should keep growing forever and the poor should benefit from that economic growth, and that economic growth is driven by using more and more energy, unless the energy system can be completely transformed and so that it doesn't involve global warming, that will become an existential threat to civilization as we know.
Okay, thank you for that. Are there any other questions? I'm looking at trying to get everyone on my screen. As I say, if you'd like to ask Dave a question, now is your chance. Comment there.
I've got Rod, Stefan.
Yeah, I can't see anyone else signaling.
I think Rod has a question.
Sorry, okay, go ahead. I can't catch that.
Thanks.
Go ahead, sure.
Yeah, thanks, Dave, for that really engaging and comprehensive overview of our current predicament. I was really struck by the figure you showed, showing the sort of 6-year impact on inequality or trends in inequality post previous epidemics. And I guess in that vein, I wanted to ask you to sort of cast your mind forward, and I wanted to ask, what's your biggest concern, or what worries you most about the next 3 to 5 years in terms of what might drive poverty trends, or for the living standards of people living in poverty?
Okay, so what worries me most is that the huge amounts of public spending, social spending we've seen in rich societies will, once the vaccination rates are high enough that it becomes possible to live with the COVID without it causing mass deaths and mass destruction, that social spending will then cease. Governments will say, we can't carry on affording this. People need to go back to work. We can't afford to keep this social spending. The poor need to stop being lazy. They've had a year off and need to go back to their low-paid jobs, and there will begin to be unemployment. There will be cuts in welfare benefit spending, cuts in service spending to pay for the pandemic. There's already beginning to be questions about the debt needs to be repaid, although the debt is to the printing press. The money's been borrowed from the central banks. It's not like it's owed to anyone. And so you will see that pattern that we've seen in the 21st century and in all previous centuries of an increasing accelerated divergence. We've already had that pattern over the 21st century, that the richer become richer and the poor to a certain extent haven't benefited, but the rich may continue to become richer and the poor may become a lot poorer. And that's in rich societies. In poorer societies, the situation may be even worse. We've already seen cuts in overseas aid budgets because of unaffordability in the UK, and other countries may follow suit, saying charity begins at home, and terms of trade may be tightened, and debts may be tried to be collected from poorer countries that simply can't afford to pay. So there is a significant danger of a considerable increase in poverty across all societies.
Thank you for that. Sorry I missed you there, Rod. Any other questions anyone would like to ask?
Stefan has his hand raised.
Yeah, I have a quick question, if I may. So one of my jobs as outgoing EASP secretary is to write a conference report. And before this session, I went through the program and I realized there's maybe an uncharacteristically high number of papers that were dealing with mental health, and particularly increases of psychosocial symptoms, stress, anxiety, even depression, in response to COVID-19, particularly in Hong Kong, but also the mainland of China. So I was just wondering whether you come across similar evidence in other parts of the world, particularly UK. Is this a regional issue that we're seeing in East Asia? And if not, how might that add to all these challenges that you already outlined and all these really deep policy problems that we might be facing in the medium and longer term?
That's a really important question. There's a perfect storm for mental health in the lockdowns and the stress of fear of the pandemic, the effects of having long COVID on mental health, the effects of the risk of increased poverty on increasing mental health issues. And many, even in rich societies, mental health services are underfunded. There's already restrictions on getting healthcare for mental health problems. I think there needs to be a major shift in the funding of mental health services across all rich societies following the pandemic. I'm not sure that's going to happen. I think there may. I'm worried that rich societies won't fund the services they need to deal with the after effects of the pandemic. Governments will tend to say, "Oh well, the vaccinations have worked. We go back to normal." So I think there needs to be a big research initiative on trying to encourage governments to fund mental health services to a much more adequate level.
Thank you.
Okay, well, I think probably now we should probably close the.
There's one more question, Peter.
Oh, there is another question. Yeah. Okay, let's have that question. Yep.
Hi, Professor Gordon. Thank you so much for the interesting presentation. I was just wondering, how urgent do you think is the application of the deprivation measures? So my understanding is that the income approach and the deprivation approach, they're essentially capturing different phenomena associated with the experience of poverty. And so, yeah, I was just curious, what's your opinion on the approach to the identification of poverty in the future?
Okay, so in Townsend's theory of poverty, lack of income is the cause of poverty, and the outcome of that lack of income is deprivation. So they're two sides of the same coin, as Bjorn Hallerod would argue. One of the troubles with measuring income is that if you're using a relative measure of income, as OECD does or the European Union does, if the income of the whole society is depressed, then the poverty line goes down and you can get some spurious results. So you can get a situation where income poverty, relative income poverty is falling, even though deprivation is rising massively. And I think we need, given the situation of a likely increase in poverty and inequality, we need to be measuring a much better way the lived experiences, the deprivation suffered by the poor, so that we can let policymakers have the information they need to have more effective and efficient anti-poverty policies, to see if their policies are working, because we're now getting into a kind of emergency situation where poverty may increase substantially, and we policymakers need to know what's working and what isn't in the context of the post-COVID world.
Thank you so much.
Okay, thank you, everyone. Thank you, Dave, for that fantastic presentation and for the questions. They've been very good, and it's been a very good session. Thank you. Thanks to everyone involved. We're going to move straight on now to the closing session, and I'm going to hand over to Stefan.